The United States is constantly at war. Do you ever think about the men and women and their mental health when they come back from their time spent overseas? Today I'm going to reassure my audience that the deployments can cause severe PTSD in our service members and raise the suicide risks. I'm qualified to speak on this topic due to my own experience with military PTSD as well as my extensive research on this topic. First, I would like to talk about combat-related lifetime trauma and the psychiatric risks among the U.S. military personnel. Second, I would like to talk about the lack of access to mental health for our service members. Third, I would like to talk about the psychological factors that contribute to PTSD. And fourth, I would like to talk about the influence and the impact of deployment. To further understand how PTSD affects our service members, I'm going to explain the combat-related trauma brings a psychiatric risk for returning war veterans. Post-traumatic stress disorder is a debilitating psychiatric disorder described by re-experiencing trauma memories, avoiding memories, thoughts, and feelings that bring reminders of the traumatic event. According to Rieger, Bosa, Smolinski, Buck, and Knorr in the Journal of Psychiatric Research, lifetime PTSD is at a 3.9% worldwide and a 6.8% in the United States. A study conducted with 24,499 soldiers, more than 50% had experienced ongoing PTSD. According to Brownlow, Zitnik, McLean, and Gurman in the Journal of Psychiatric Research, investigated the impact of lifetime trauma was encountered during and outside of deployment. Having a better understanding of PTSD prevalence in service members, veterans, and those enrolling into the service is crucial for managing mental health resources, and that leads me to my next point. Recent reports show that military personnel have experiences that have affected their mental well-being. The efforts to gain mental health services after deployments are often met with significant obstacles. Ronald D. Hester in the International Journal of Mental Health Systems that the suicide rate increased more than 18% from 2011 to 2014. I have personally suffered from lack of mental health services within the local VA clinic. It's been a big topic of conversation that the VA needs to do a better job to help my brothers and sisters in arms and dealing with their PTSD. That brings me to my next point. I'm going to go over a few signs and symptoms that our veterans face while dealing with PTSD. Many veterans display depression, poor sleeping habits, weight loss, feeling like a burden to others, drinking, and drug use. Many veterans experience anxiety attacks, flashbacks, and lack of interest. According to Carla Groves in the Journal of Human Behavior, there's no definite answer as to how many war veterans suffer from PTSD. The reason behind that is because they have yet to make a disability claim or seek help. This brings me to my last point, the health and impact of deployment length. Deployment can take a heavy toll on the mind, and my last point, I will be going over the lengths of deployment associated with PTSD. Each branch has a different length of deployment according to Buckman, Sudan, and Green in the Journal of Occupational and Environmental Medicine. As deployment lengths increase, so does the risk of personnel to suffer adverse health effects. 76.9% of veterans were deployed from 2011 to 2001 with an average of 1.5 deployments. I hope that I have informed you well enough of the negatives on the lengths of deployment and how difficult it can be to seek medical help in the U.S. military. Please, I ask that you keep all the men and women who have served and continue to serve our country in your thoughts and prayers because we all struggle from some sort of PTSD. Thank you.